Most people think that chiropractic care is just about cracking someone's back, but it's actually a lot more than that. It focuses on how the entire body moves, heals, and functions together. So during my internship, I got to see how real chiropractic care is used not to only treat injuries, but to also prevent them and improve overall performance. So, my first slide is what is chiropractic care? I would talk about how it's a type of healthcare that focuses on spine and joints. It uses hands-on adjustments to reduce pain and improves movement and helps the body function better. So from here, I would then transition into why did I get into it? Why did I choose chiropractic care? And I would say that I've always been interested in how the body works. It's always been one of my fascinations. I'm taking physiology right now, and it stood out to me because it focuses on helping people recover and feel better without the need of surgery, and I just find that really cool. So then I would go into the location. It's located in Costa Mesa, Atlas Wellness Chiropractor Center. Um, it's equipped with rehab equipment, treatment rooms, and exercise space. I would say it's focused on sports medicine, physical therapy, and overall health. And from here is the perfect way to go into my mentor, Dr. Rice. He has a doctor of chiropractic, and he's the co-founder of Atlas Wellness Center. He has a background in human nutrition, biochemistry, and he's the official chiropractor for the U.S. Open of surfing, and he's a former competitive surfer himself. So, yeah, he provides care for sports injuries and rehabilitation, and he speaks multiple languages like English, Spanish, and French. So from here, I would say what I did. What did I do during this internship? And I would say all these bullet points here that I'm going to go more in depth about, but for now, I'll just say them. So I interned at a chiropractic office. I observed patient consultations, learned more about spinal alignment, watched chiropractic adjustments, saw how chiropractors treat pain, asked questions about their career, and gained hands-on learning experience. So, if you would ask me what I learned, I would tell you these bullet points as well. Importance of spinal alignment, how posture affects health, basics of chiropractic adjustment, ways to reduce back and neck pain, and communication with patients. So, once again, I will go more in depth on this on actual presentation day, but this is just the basics of what I would say. So then this is my assessment on ankle sprain. So this is what I did in Mr. Broncar's class. It's my process speech. Basically, it's just the same thing. But I would say feelings of pain, swelling, and injury all relates to the ankle sprain, which is the most common sports injury in the world. It has 2 million happening annually and 25,000 cases a day, which is a lot. But what people don't know is that it's proper treatment that determines whether the ankle heals correctly or not. So it's not just about resting, it's about movement, strength, and stability that keep it intact. So this slide is very important. It's my determined severity slide. This will be more important later on the road, but for now, it's just the grades of an ankle sprain. So there's 3 grades, grade 3 being the worst, and it's just a tear of the ligament. So that's all that's important. So what chiropractors look for? They look for bruising, swelling, and tenderness. And step 2 is reducing inflammation. Rest is absolutely necessary, especially when you hurt your ankle. You don't want to walk on it. So ice is important. Compression wraps for swelling. Elevation for no fluid buildup. So you want to elevate your ankle above your heart so no fluid builds up. So restoring range of motion is the 3rd step. Stiffness is common after you hurt your ankle, so introducing controlled movements is important. Exercise your ankle slow, and this helps to heal ligaments. So next is the 4th step, strengthening the ankle. Weak muscles risk re-injury, and no one wants that. So resistance bands are a really good way to strengthen your ankle. You can do different exercises with them, and you can do heel raises for calf because the calf is connected to your ankle. You're going to want to exercise slow with control because you don't want to hurt yourself more. The 5th step is balance training. So injury like this affects proprioception, and what that is basically your body's ability to know where it's at. So having a foot on a stable surface is a good way to test that. It helps your body react quickly and improve stability, and here's some exercises right here that I would talk about. Next is sport-specific training. Jogging, jumping, cutting in different directions are all good ways to see where you're at. Practice at a controlled pace, of course, because you don't want to hurt yourself, but this step basically prepares athletes to return to their sport if they had a sport injury and they need to return. So even after you're healed, you want to keep up with your strength, flexibility, and balance. So prevention is the 7th step. Proper warm-ups like squats, lunges, and other things. You need supportive footwear that help your ankle, and continued exercises. So this would be my case study. This is the interactive part for the judges to do. But basically what it's going to be, I'm going to have 3 patients right here. Here they are. And here's my first patient. His name's Caden Johnston. He's age 16 years old. He plays lacrosse, and his injury, of course, is an ankle sprain. And so I'm going to have a little description like this, and the goal for the judges is to guess the severity or grade. So I would show a picture of an ankle like this, and here's a torn ligament. So from this knowledge, you would have to guess what the grade is. So the ankle is slightly torn, so this would be grade 2. Here's my next patient. His name is John White. He's 52 years old. He likes hiking, and of course, his injury is an ankle sprain. So his severity is his ligament is torn all the way through. So from this, you can tell that it is grade 3 ankle sprain. Here's patient 3. Her name is Caitlin. She's 12 years old. Her activity is dance, and she has an ankle sprain. So here's her ankle, has a little bit of bruising, and her ligament has slightly a little bit of effect. So this would be grade 1. So here are the skills I've gained during my internship. I gained communication skills, professional behavior, observational skills, time management, organization, understanding patient care, which are all very important to my life now. So here's my career reflection. Is this something I would want to do? I have confirmed interest in the healthcare, so I learned a lot about chiropractic career, saw daily responsibilities, and I really did enjoy being here. I think it was valuable real-world experience, and it helped me towards my future goals. So if you were to ask me if I wanted to pursue this career, I would say yes, and I would talk more about why I would in my final presentation. And next is my thank you slide. So that's it. That's my whole presentation so far. Thank you.